turn it off. But I'll show you what you do with let's say she's got facet syndrome this side. You just hold your gun there, and you definitely don't want anybody touching your table when you're doing treatment or testing. So, and you just fire into the sacrum. So you find where the mammillary is there, and that's the sacrum, and you put it there, and you fire down, and you fire up. So that's all you do for facet syndrome. And then you're in there. That's it. So once you've done a click, yeah, I just showed you how to do it. So once you've done 3 clicks and 3 mobilisations, and you've done your skin pull, now she's ready to turn over on her back.
Is that click alternate one that you just on the second?
That was L5S1 facet syndrome.
You're doing it on left and right.
I was just pretending. I turned the gun off with it had no. Whereas
but you'd be on. I guess what we're asking is you'd be on the side. You'd be on the facet. On the facet you'd go.
Yeah.
1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3.
Bring the model just to clarify. So if people have got facet syndrome, so all we've just done is we put a pillow under here. We click below the axis of rotation, okay, here, which is below S2, and then we've mobilised this way to lift the base of the sacrum up with something under here, yeah, which is lifting the base of the sacrum up, which is lifting L5, and we did that 3 times. And then we clicked again, and we mobilised again, okay. We tested for an anterior L5, she's weak, so we pulled the skin. Didn't pop, but it can pop, and it gives people a good resolution of their symptoms. But if it doesn't pop, doesn't matter, you can try 2 or 3 times, it's going to help things. Usually, but not in, it's Lauren? Not in Lauren's case, but it's the only time I've never found it, but you're unique then, aren't you?
Is it because your corrections are so good?
I've never not found it after those corrections. This is the first time. This is the first time. So this is the first time in teaching in many years that I've not found it. But if you, all the test was pushing the sacrum and L5s, this, what's this called again? This is the inferior articular process. So you just push these 2 together to compress them. Your reactive leg will pull up. Or if you don't like doing leg length testing and you want to feel AK, you just feel the leg is strong with 10%. That you just get a nice solid contraction. It's not a test of strength, it's a test that the muscle is firing quickly and strongly with just 10% of the force. And the lighter you go, the better it is. Any more than 20 and 30%, you're starting to test muscle strength. We're not trying to test muscle strength, we're trying to test nerve firing muscles, aren't we, right? So you just 10% when you, I didn't show you on Lauren, but you get thumb and forefinger and you squeeze them together. Squeezing them together is approximating them, isn't it? And then you get them to contract, and if it's wobbly with 10%, you found facet syndrome, right? And then you're going to test the other side, and it's really common with an anterior sacrum, okay? And then if it's wobbly, and you can do the opposite, you can spread the 2 fingers, and then it'll be nice and strong. And then all we're doing with the clicker is we contact the mammillary process, and then you fire inferiorly, click, superiorly, and you're separating the joint like that. If you found it both sides, you contact the mammillary process, and then you fire into the subalar, fire into the inferior articular process or the mammillary, just to separate them. But she hasn't got that problem. But that's what you usually find. So this is just a gentle routine to treat spondylolisthesis. So you're going to hit below S2, you're going to mobilise, you're going to do 3 sets. And then you're going to check for an anterior sacrum, an anterior L5. If it's there, you're going to do a tissue pull. Then you're going to check for facet syndrome with either leg length testing or AK. Then you're going to turn the patient into supine, and we're going to do some knee hugs with fingertips just below S2 to act as a fulcrum. to do some dynamic something or other. Come close to me. It'll be useful. Thank you.
They usually like that feel too, huh? When you get that,
Yeah.
that distraction on.
So I'm gonna get her to do some of the work because I'm lazy, you know. So interlock your fingers. Don't mind me putting my hand between your legs on your sacrum. It's alright.
That's fine.
So I'm just gonna find base of sacrum. So there's 5. There's 1. There's 2. So I'm just below 2. So I'm just gonna do some traction, and I'm just pulling this way and pushing that way, and I'm just pushing her up like that. And this is what I do for a spondy that comes in, and I know it's a spondy, and I want to do. I'm never going to go for an aggressive technique first. I'm not going to stick them in side posture and do a heavy HVT and try to be a hero. I'm going to treat them 2 to 3 times a week with this routine, and I'm going to stick them in side lying. I'm more likely use them in differential on their lower back or TENS or some type of modality because it helps settle their pain down. Do you use modalities here or not?
Mhm.
You do? So I think in differential on the lower back works really well after manipulation. Or if you're into acupuncture, you know, acupuncture with electro is like really good in it for reducing the pain after the manipulation, getting things aligned, get all the mechanoreceptors all deactivated, and stick the needles in and wire them up, or doing differential. You're on a winner, aren't you?
Just started doing infrared over his needles. He said that works good.
Yeah, well, whatever you want to do. But she's going to like this. And if you go on the side to face me, osteopaths may spend time doing, you know, pulling the sacrum. There's 5, there's 1, there's 2. So I pull there and get her arm maybe out of the way, put it under your head. And I might spend time doing this kind of thing. She's already in lots of pain. And kind of probably feels good to you, doesn't it? Centrally, I think, on the sacrum, and trying to do, you know, I was taught this in DO school. But this is really good for something. You might like her on the side a bit more. But that's what I'm going to do for someone, and then as homework, I'm going to give her double leg knee hugs. She's going to interlock her fingers, and I want her to do this often, and sideline and ice pack, maybe buy a TENS machine, and
Tell you what I found with this. So my dad's, a lot of my family has spondies. I get them to do this in the morning, and a lot of them will feel kind of a clump, but I tell them to go each direction.
Yeah.
One way I feel good, one way I feel bad. Only go the good way.
Definitely.
Doing a clock like that, and sometimes they'll feel. My dad will feel a clump, get up and feel.
You can come. There is another. If you wanna know, there is this. Come closer. Come closer.
Two.
Yeah, closer to the edge. That's good. You can, you know, do this. Another.
Did you ever see that machine on Amazon?
Yeah.
Mm-hmm.
Came on the infomercial for everyone.
This is just too much hard work for me. I can't be bothered.
No, I was saying have Zoom do it as an exercise.
Yeah, I've seen it. Yeah. The other really good thing that they like that they have a spondy is if you sit on their feet. Can you handle that?
Mm-hmm.
I know I'm heavy. Is it okay?
Yeah, that's okay.
Yeah, I'm not going to damage your permanent, am I?
No.
I'm going to get collapsed arches. Okay. Here's yeah, I'm going to have one of the legs here actually. Don't want to fall off the end of the table, have another accident. But just traction of the lumbar is another really good thing that they like for a spondy. And you're probably like that as well, aren't you?
Yeah.
So just, you know, it's another osteopathic technique. So you can kind of hold them there and give them a HVT as well. Sometimes you get a pop. So all these things I'm just showing you are the gentle way to treat a spondy. Or just anterior sacrum with an anterior 5 with a question mark over a spondy that you don't know until you've got an X-ray. Yeah. Do you like that little routine? It's my gentle routine that I like to do. But I will do that on every person that comes in the clinic before the drop table, before side posture. every person, and I'll do that 2 to 3 times a week for a couple of weeks with rehab, with electrotherapy, with ice, with TENS, and if they settle down, and then with rehab, I'm happy. I won't use drop and I won't use HVT. And 80% of them settle down and don't need the drop and don't need that, and that's all you need is gun, mobilisation, and all these things in this routine that I just showed you. It's all been video, yeah? Cool. Alright, so why don't you just play at this, try and find anterior sacrums on people and practice this.
Well, if you want to use it, are you going to show us the drop too, though, in the HVT?
So I'll show you the drop and I'll show you the side posture, and I reckon that's as many techniques as you can take in for a day, and then it's up to you to practice until we finish at 5:45, yeah? Alright, I'll show you the drop. I'm quite sure your back feels if you bend forwards first a few times, because that's what's good for you. That's what's good for you. But going backwards is just go back a little bit and then come back. But I think going back is going to be more comfortable for you than it's been in a long while.
Yeah.
In your lower back.
Yeah.
It's more comfortable, isn't it?
Definitely.
Do you mind if I use a drop table on you? If you could just lay face down. Come back down. Just as I've got older, I've just got less poppy and more gentle. But yeah, there's a time and a place for HVT, and when that sacrum is stuck, I'm definitely going to use HVT, but it's not my primary thing. If I can use the gun and the drop and mobilisation, I will first. I can smell chocolate. What is it? Is it hot chocolate cooking or something?